The summary of the documentary, The Operation by Marcia Garcia. American troops landed on the island of Puerto Rico in 1898. 2 years later, Charles Allen, the first American civilian governor, stated that there were too many peasants and poor people and too few men of capital. Soon American corporations began to arrive, and by 1930 they owned more than half of the land. Dispossessed of their land, thousands of peasants were forced to work in the U.S. mills during the harvest. Unemployment reached 37%. The dispossessed, uprooted, unemployed rural population became what the planners called overpopulation. Governor Blankenship approved Law 136 in 1937 legalizing sterilization. This law, based on the principles of eugenics that advocate the procreation of health and resourceful individuals and the limitation of poor or sick, came to solve, according to Governor Blankenship, the urgent need to avoid the threat of constantly growing population. Before, there were no incentives of that to avoid children. The only means was by sterilizing. I didn't have to donate blood or anything for free. Sign my children's father as long as they would operate on me. I was operated after 6 days. I was living badly in that little room over there with 5 to 6 children. It was a small room, and the situation was so bad. Then I had to wash, iron, and so on to help raise the children. And do you think the fact that you had a surgery helped you to be able to work outside the home? The needs. The needle industry, the sewing women did in their homes or in small workshops for Marcia, for mean wages, flourished in Puerto Rico during World War II, which had paralyzed the sewing industry in Europe. The law allowing the operation was passed precisely when women's work was the only source of income for thousands of Puerto Rican families, and many women were forced to be sterilized. Women's fertility was of great importance to the first inhabitants of Puerto Rico. Fertility represented 1% of women of childbearing age. As early as 1946, 7% of Puerto Rican women had been sterilized in government hospitals and private clinics. This is the pro-sterilization propaganda. Changing times. In the world in which we live, this is Puerto Rico, a tiny dot and a large population in constant growth. But Puerto Rico struggles to progress, and progresses. Every activity related to this progress is carefully planned. The farmer plans his planting to obtain more and better fruits. And this other fruit, the Puerto Rican child, the conditions in which this child's life is to unfold must be carefully planned. 1,500 volunteer leaders serve Puerto Rico by taking the life-saving message of the Planned Parenthood in the countryside and villages. The use of these methods eliminates the practice of illegal abortion. The Pro-Family Welfare Association repudiates this practice. If the doctor recommends it and the couple so decides, the association cooperates with the couple to make possible the sterilization of the father or the mother. And now, our Caribbean report. Puerto Rico, a beautiful little island with a big problem. Today, April 30th, 1945, Mr. Topman, head of the U.S. Tariff Commission, has suggested the immigration of 1 million Puerto Rico as part of plan to reduce the island's population problem. In 1953, 17%, almost 1/5 of women of childbearing age had been already sterilized. January 24th of 1948, the New York Times reported today that the birth rate is declining as a result of the high incidence of sterilization and migration of young people to the United States. Across the island, sterilization rates range from 10 to 42%. The 42 comes from a factory on the outskirts of San Juan. The Barceloneta sterilization program was carried out with the collaboration of the Puerto Rican Family Welfare Association, an organization financed by American millionaire Joseph Song. Song subsidized 11,000 sterilizations and used Puerto Rican women to test his product EMCO, contraceptive form produced by this company. The population explosion has not yet occurred, but these may be the last minutes before the bomb goes off. Perhaps the population explosion will lead to another type of explosion. Perhaps the people will rebel against the system. Millions of dollars are being invested by private foundations in population control studies in countries such as Puerto Rico and India. The first experiments with the contraceptive pill, 20 times stronger than the one used today, were conducted in 1956 among Puerto Rican women living in government housing complexes. I did not work at the Puerto Rico School of Medicine during 1960s.
Pretty obvious to us then was that Puerto Rico was being used as a laboratory, and it was being used as a laboratory for the development of birth control technology.
Between 1968 and 1972, the United States Agency of International Development Aid diverted $100 million from the medical aid budget to population control in Latin America. Dr. Dick Gravehold, director of AID's Office of Population in 1977, stated that the goal of the United States was to sterilize a quarter of the world's women in order to prevent revolutions hostile to the commercial interests of the multinational corporations.
Dick Gravehold, que es el que dirige la división de planificación familiar de AID.
Dick Gravehold, who heads the family planning division of the Agency of International Development Aid, understands that making family planning services available and easily accessible to the patient is a very important factor. We managed to avoid about 10 to 12,000 births per year through the high recruitment of patients in the program. That was one of the goals. In other words, that we would reach, of course, eventually cover 100% of the population at risk, because women of childbearing age who stayed at home, what they have to hear is the sermon. Those are the ones we have to bring, because those are the ones who will help us reduce the birth rate to zero population growth, which I'm telling you is long term, right? But those are the ones who are going to be able to deal with the replacement population level of 2 people per family, 2 people per marriage, the 2-child family. We also had a family planning clinic in the factory, that is, especially where there were a large number of female workers, women. Then the company gave them a 1-hour break, and they went to the family planning clinic in the same factory, so that they did not even have to go to the center of town. And when the industrialists would meet at the Industrialists Association, I would go and talk to them. I would say, I need your collaboration. And we would have numbers. Look at the maternity benefits that the company saves. it is for you profitable. It's for you profitable to let those women stop working for an hour and go to the family planning clinic, because in time, not only what it costs the company and they had to pay for the child birth, but the 2 months that the law in Puerto Rico prescribes that a woman has when she gives birth, you see, 1 month before and 1 month after, productivity of that person, which is zero in those 2 months, meant millions of dollars for the company. During the 1970s, inflation and unemployment reached alarming proportions. More than half of the population began receiving food stamps with the inauguration of a massive subsidy program for low-income families. 1/3 of the factories opened in the 1950s moved to other countries in search of cheaper labor, but the new pharmaceutical, electronics, and petrochemical industries that were established in the 1970s employed far fewer workers than those that were closing. Faced with this situation, in 1974, a government report again recommended the use of migration and the reduction of the birth rate as a solution to the problem. It was in that same year that the government program led by Dr. Antonio Silva was launched. 24,000 women were sterilized in 2 years. This is the genocidal plan that is being proposed for Puerto Rico. October 31st, 1974, today at the United Nations, Puerto Rican independence leaders accused U.S. imperialists of carrying out genocidal plan in Puerto Rico. According to government statistics, in 1974, a total of 200,000 women, or 35% of women averaging 26 years of age, had already been sterilized.
Point in time where abortion rights are under such tremendous attack that the government is no longer funding abortions for women who cannot afford them, sterilizations are still being paid for by the government and are on the increase. It appears that sterilization as a solution to the so-called excess population in the United States is following the model set up in Puerto Rico.
South Darius Radio Rock in Ponce, Puerto Rico, in the contest win with the lyrics of "Good morning, Mrs. Arid Cabin. May I speak to you for a moment? Does this dog not bite?" In Puerto Rico, government efforts to control the population continues. I came one day because we were missing planning clinics, and they wanted to know if you were planning to return to the clinic. No, but anyway, thank you, I already say, but we didn't notify, but they didn't tell us. Well, thanks a million, and excuse me, we can see you on Tuesday. But as soon as your husband returns, well, go to the planning, because it is not good to have the children so often. Thank you, and see you another day. Mrs. Teresa, we want to know the reason why you are not attending the clinic. Let me give you the appointment so you don't forget it tomorrow. See you, Mrs. Teresa. This morning we are going to have a talk about female sterilization. When you live here and sign the consent form, you will go to the office next door and the secretary will give you an appointment. In the last 40 years, Puerto Ricans have migrated massively. 1/3 of the women have been sterilized. However, the problems we started will have not improved.
Today, more than 60% of the population lives below the official poverty level. The unemployment rate has more than doubled in the last 10 years, while U.S. corporate profits have risen a staggering 550%. How can we continue to insist that population surplus is the only problem, that there are simply too many people on the island? The real problem is how the conditions of life can continue to worsen for most Puerto Ricans, even as the island's human energies produce massive profits and wealth for United States corporations.
Mass sterilization has not been the hoped for cure for Puerto Rico's ills. However, as long as economic inequality limits and stifles the Puerto Rican family, the U.S. government and the Commonwealth will continue to sponsor the operation.